So welcome back to part two. Well, we are going to now continue our discussion on race and child welfare. Now in this section, we're going to focus more on moving towards solutions. So we've talked quite a bit about what are some of the causes of disparities. We've given a lot of data about showing how pervasive the disparities are across systems. Now we're going to give some examples of what can we do? What are some system responses to disparities? And then we'll talk a little bit about cultural competence at the end in the final part of this session. So as we discussed, this is a complex issue with complex causes, and so necessarily this is going to involve complex solutions. If we go back to our handy pyramid that we've been using throughout the semester, we look at the different points of intervention. I think this can help us think about addressing racial disparities in this kind of complexity. We can use this to look at what points can we intervene? What can we do at that preventive point? What are some supports we can put in place for families to prevent them from even coming to the attention of CPS? Once they're in CPS, what interventions, what strategies can we use to make sure that families are not being treated disparately because of their race or ethnicity? So what can we do at each of those systems? Foster care, adoption. And so I'll be referring back to this, but if we think about this with the pyramid, that we can see that there's different levels of intervention and strategies that jurisdictions are using all over the country, and they're intervening at multiple points at the same time to try to make an impact on racial disparities. So what are folks doing across the country? Is there any promising research out there yet? Unfortunately, there's not a ton, but there have been some efforts to really begin to test and look at what strategies are actually effective in reducing disparities and disproportionality. And some of the promising practices include some of these things. And so the first thing is that they're going lower on that pyramid. They're really shifting efforts and putting a lot of attention, intentional focus on that early points of intervention, shifting towards prevention, towards helping families meet their basic needs. So that's one thing folks are doing. They're also using the data that we just talked about. So even though now there's a clear and compelling picture, this is not always the case. So jurisdictions are improving their data collection systems so that they can see for their jurisdiction where are the disparities the worst. That can help them focus their limited resources to say, our issue is with mandated reporting. We see huge disparities at that point. Or in our jurisdiction, we have an increase, like in New York, an increase in disparities for that decision to place kids in foster care. So what can we do at that decision point and put some efforts based on what the data is telling us? So we need accurate data. We also know that this is not just going to happen with one team, one agency, that this needs to be both countywide and often statewide support for very explicit focus on putting attention to addressing racial disparities. And this has to be done at all levels of the child welfare system. So having common understanding of the problem and using that data so everyone knows what the real issue is and why it's a compelling issue, and then having common goals so that you can intentionally focus the work towards addressing disparities. We also know that if we go further up the pyramid and we still see disparate treatment, there's things that we can do and that we are doing nationally. The Fostering Connections Act of 2008 is really focusing on increasing access to supportive services for those kinship caregivers. Again, we know that children of color, particularly African American children, multiracial children, are much more likely to be placed with kinship caregivers. And so some of these national policies, federal policies, and state policies are increasing supports and access to services for those families. Families that traditionally may have, you're taking care of your grandson, so their family, what you're doing, we're going to place the child with you and then walk away, not acknowledging that many of these children, of course, come with trauma experiences, may have increased behavioral, emotional, mental health needs, but oftentimes these kinship caregivers were not receiving that support. So focusing on that piece is something that we have seen improvements. Engaging families and extended families in key decision making and planning. So the idea of reducing risk of some of that institutional individual bias at some of these decision making points, if we bring in family and extended family and really partner with them, help engage them in safety planning so they can safely care for their children, we may reduce some of that bias that we see at some of those decision-making points. And finally, some policies that have been in place for many, many decades, like ICWA, strategies to support Native American and tribal sovereignty. So, ICWA was an excellent step in the right direction, but we know that compliance of ICWA has not been always have very high rates. So looking at enforcing some of those strategies, as well as increased support, so federal support, state support that's going directly to tribes so that they can develop and strengthen their own child welfare systems within the tribes. And so we see that happening as well nationally. The tribes are getting that support and technical assistance to strengthen their own systems to make their own decisions and their own sovereignty. Another thing that we can do and that jurisdictions are doing is applying a racial equity lens. So what does that mean? That means that you examine any new or existing, but particularly any new policy, any new practice, that you examine those practices carefully with a racial equity lens, meaning how is this particular program, this particular policy going to impact this racial group? Is there any unintended consequences? So thinking about those things, not down the line, years down the line, but thinking about those things as you're implementing those programs and policies. So applying that racial equity lens up front as you're making decisions, as policymakers are making decisions or administrators are making decisions to implement new policies. And I want to give one specific example here. So there's, through the Breakthrough Series Collaborative, which is through Casey Family Programs, this is an example that began a decade ago, but we're still seeing some impacts. It was a statewide effort to reduce disproportionality in Texas. And I list the partners here so you can see who the partners were. But I think one of the exciting things about this is that you really saw collaboration from the county, the state level, private agencies, foundation support through Casey. So all of these folks came together with a very intentional sole focus of addressing racial disproportionality. They used a combination of strategies. They added a significant cultural competence, not just for their workers, but they added undoing racism training. So looking at structural issues of racism within their institutions, and that was also for management as well as staff. They worked with working with local communities, church and religious organizations to improve access and really invite more and recruit more foster and adoptive parents of color. They had community advisory committees that really shaped the practice and the work. And so not just kind of a figurehead, but really engaged community members to talk about how can child protection work more effectively with your community. They, again, this idea of intentionality, they had a state level director that was solely focused on these efforts. And so it was a point person and kept people accountable to the work of reducing disparities. They also increased diversity among CPS staff. So recruiting, finding strategies to recruit staff and engage staff from the multiple communities that they were serving. So this program began as a pilot in 5 counties, but eventually went statewide. And the early results from this are really positive. 4 out of the 5 pilot counties actually saw a significant decrease in disproportionality. And so I want to I know there's been a lot of data and that it can feel overwhelming, but there are initiatives out there. It just takes a very concerted and multi-systemic effort. And so I think this is one example where has seen success. I am going to ask you now to look at one other effort. And so as we saw in New York, it's true in many jurisdictions that one of the initial areas of racial disproportionality is at that initial reporting to child protection. And so many jurisdictions are thinking about what can we do to begin to address disproportionality even before a call comes to our attention. And so that really requires community outreach, responding and reaching out to the mandated reporters. And so this link discusses one program that is really aimed at specifically kind of awareness and education to that group of mandated reporters. There's also some links in the module that highlight a few other initiatives. The Alliance for Racial Equity, there's a link to that organization, as well as some more links to other Casey programs like neighborhood initiatives, family to family. So concentrated multi-systemic approaches within neighborhoods. So those, especially neighborhoods at risk, neighborhoods of concentrated poverty, that there's efforts at the neighborhood level that try to maintain children, even if they can't be maintained at their homes, to maintain them in their communities. So they can still have those relationships maintained, those connections with neighbors, with their community, with their schools. And so there's some exciting neighborhood initiatives as well out there. And there's some links to that in the module. So now we'll pause. You can watch the YouTube clip on the mandated reporting, and then we'll come back to finish up this module.